This is Plant-Based Briefing, The True Cost of Malnutrition by Nelson Huber-Disla and Colin Campbell at nutritionstudies.org. And I'm Marian Erickson. This is the curated content plant-based podcast where I narrate articles on healthy, compassionate, and sustainable living with permission in about 10 minutes or less every weekday. So now let's get to today's Plant-Based Briefing. The True Cost of Malnutrition by Nelson Huber-Disla and Colin Campbell at the Colin Campbell Center for Nutrition Studies at nutritionstudies.org. The word malnutrition is most often used to describe diets deficient in calories or essential nutrients. Chances are high that you've heard it used in that context, associated with starvation and extreme poverty. But this is only one side of malnutrition. Taking its definition literally, the prefix mal meaning poor or faulty, malnutrition should also apply to dietary patterns of excess that produce obesity and diet-related diseases like heart disease and type 2 diabetes. These cases of malnutrition are on the rise. 1.9 billion adults worldwide are now overweight or obese, more than 4 times as many as are undernourished, 462 million. This growing gap is most pronounced in high-income countries, but even the low- and middle-income countries that bear the greatest burden of undernourishment are experiencing rising rates of obesity and overweight. This article will focus on the chronic disease side of malnutrition. The damage it causes is ignored too often. Lives lost, the ultimate cost. The most obvious cost of malnutrition is death. Although not typically listed as an official cause of death, many of the top causes of death in the United States have strong ties to our unhealthy diets. Consider the Centers for Disease Control and Prevention's, or CDC's, most up-to-date list of the top causes of death in the United States, rounded to the nearest 1,000. 1. Heart disease, 647,000. 2. Cancer, 599,000. 3. Accidents, 170,000. 4. Chronic lower respiratory diseases, 160,000. Stroke, 146,000. Alzheimer's disease, 121,000. Diabetes, 84,000. Influenza and pneumonia, 56,000. Nephritis, nephritic syndrome, and nephrosis, 51,000. And suicide, 47,000. View more facts on malnutrition in this infographic linked here. To some extent, malnutrition plays a role in almost all of these causes of death. For example, up to 90% of heart disease deaths, 70% of cancer deaths, and 50% of stroke deaths could be prevented by the informed use of nutrition. Likewise, it is widely accepted in the medical community that most type 2 diabetes could be prevented by better nutrition. If we were to adjust this list to account for only those percentages, to account for the shared cause propelling only those deaths, there would be no denying that malnutrition is the #1 cause of death in our society today. Even causes of death that seem less tied to nutrition deserve a closer look. Take, for example, accidental drug overdoses included in the broader category of accidents and suicides. On the face of it, these so-called deaths of despair, which have never been higher, have little to do with nutrition. But when we consider the psychological distress caused by being unwell, confused about how to treat oneself, and unable to pay for expensive treatments, more on this in a moment, that often rely on addictive drugs and by and large fail to treat the root cause of the illness, we see that mental and physical health are tightly intertwined. In short, none of these factors exists in a vacuum. The web of nutrition-related diseases is a messy tangle. So long as malnutrition exists, and so long as it is a major drain on our quality of life, producing numerous preventable diseases and their accompanying costs, it will also contribute to our despair and resulting deaths. But just how severe is this drain on our quality of life? Can we begin to quantify it? The cost of malnutrition to individuals. The financial costs of managing diseases caused by malnutrition probably seem more profane than the lives lost, but these costs are significant. Take, for example, the 2 leading causes of death listed above, heart disease and cancer. According to a paper published in the American Journal of Managed Care, AJMC, patients with established cardiovascular disease paid nearly $19,000 annually in direct costs for medical treatment, an economic burden substantially greater than current American Heart Association estimates. Meanwhile, for cancer, the average cost of 1 round of chemotherapy ranges from $20,000 for office-managed to $26,000 for hospital-managed. Most Americans cannot deal with these costs. 63% of Americans cannot afford an unexpected bill of even $500. A bad diagnosis is, for the vast majority, not only a threat to their lives, but also a financial death sentence. For a poignant illustration of the resulting desperation, we only need to look at the flood of fundraisers asking for assistance with medical bills. On GoFundMe alone, this category of fundraisers makes up over 250,000 campaigns per year, more than twice as many as exist for education, memorial, or natural disaster emergency fundraisers. A well-publicized study published in the American Journal of Medicine, completed by researchers from Harvard and Ohio University, shows what happens to those individuals who cannot raise funds elsewhere. They found that 62.1% of bankruptcies in 2007 could be attributed to medical expenses. One of the startling details from that study was that most medical debtors were well-educated, owned homes, and had middle-class occupations, and 3/4 had health insurance. Where does that leave the uninsured, or low-income Americans who on average suffer from a higher prevalence of poor health outcomes? Regrettably, these numbers are not moving in the right direction. The proportion of bankruptcies attributed to medical bills in 2001, just 6 years prior, rose by nearly 50%. This makes sense given that the cost of treatment has also increased. According to data assembled by the Peterson Center on Healthcare and Kaiser Family Foundation, on a per capita basis, health spending has increased over 31-fold in the last 4 decades. Inflation-adjusted per capita spending on prescription drugs has also increased. The cost of malnutrition to society. Although not all healthcare spending can be attributed to malnutrition, trends in the cost of healthcare nevertheless illustrate the major trends, and it's clear from those trends that we are not on the right track. Health expenditures as a percentage of GDP in the U.S. are more than 3 times greater than they were 60 years ago and remain significantly higher than the healthcare spending in other high-income countries. The CDC's Health and Economic Costs of Chronic Diseases webpage illustrates the problem well. Here are a few highlights cited on that webpage from various reports that you can find listed in their references. Chronic conditions account for 90% of the nation's $3.5 trillion in annual healthcare expenditures. Heart disease and stroke cost our healthcare system $199 billion per year, not including lost productivity of $131 billion. In 2013, more than $300 billion in cost was attributed to arthritis. Nearly $150 billion in cost is attributed to obesity each year. $327 billion in medical costs and lost productivity were attributed to diabetes in 2017, and the cost of cancer care continues to rise and is expected to reach almost $174 billion. However, the reason this webpage illustrates the problem well is not only because it catalogs the economic toll of malnutrition-related diseases and illness, but also because it completely ignores nutrition. The word nutrition does not appear once on the entire page, neither does diet. This absence is especially shocking given that the site does make mention of 3 other risk factors: cigarette smoking, sedentary lifestyles, and excess alcohol consumption. The problem it illustrates ultimately is not only that malnutrition contributes to astronomical costs, but also that so many prefer to ignore it. How will we begin to address these problems if even our trusted institutions fail to acknowledge their existence? The cost of malnutrition is a moving target. It's useful to repeat the earlier questions. Just how major is this drain on our quality of life? Can we even begin to quantify it? The answer, for now, is no. We know the cost of malnutrition is deep. We know it's difficult to quantify. It's always changing. In just this short piece, we have barely scratched the surface. Even still, there are plenty of challenges to wrestle with, and the first and last of them is the same. We must stop ignoring malnutrition and the damage it causes. We should call our dietary patterns of excess what they are, admit the primary cause underlying so many premature deaths in this country, and not be afraid to confront its consequences. To ignore malnutrition is to ignore a tremendous opportunity for growth. You just listened to The True Cost of Malnutrition by Nelson Huber-Disla and T. Colin Campbell at nutritionstudies.org. And I'm your host, Marian Erickson. And this article is part of a series they're writing on the book, The Future of Nutrition, An Insider's Look at Science, Why We Keep Getting It Wrong, and How to Start Getting It Right, written by Dr. T. Colin Campbell with Nelson Disla. And that's available. It was released in December of 2020, and there'll be a link to that in the article. I always link to the original article in the show notes, so you can find it there. And I love how they define malnutrition using the literal prefix mal, meaning poor or faulty. Tune in for the next 2 episodes as well. Healthcare versus disease response system. And this article brought 2 things to mind as I was reading it. One is, I have a GoFundMe I've created for a friend. He's a neuro ICU nurse in Asheville, North Carolina, whole food, plant-based, super healthy guy, but he found a brain tumor and he has had surgery, has to continue to travel for MRIs and follow-ups, and it's incredibly ridiculously expensive. So I've got a GoFundMe out there for him for this very same reason. If anybody has funds to spare, it's gofundme.com/kai-fen. That's KAI-FENN. And the other thing that came to mind is the documentary, What the Health. I really recommend everybody watch that. I will put a link to it in the show notes, and it is extremely eye-opening about the money behind our healthcare system. So please share this episode with anyone who might benefit, and thanks for listening.